Hello, everyone. Thank you very much for joining us. Our today's session is a webinar, Mindful Living, NCD Prevention in Europe. I am very happy to all people who had joined us. So I say good morning, good afternoon, good evening. Thank you very much for coming. I hope all speakers will satisfy you with information, and it is also a chance for me to present my organization, World Patient Alliance, which will give you an opportunity to know more today about non-communicable diseases. As you know, non-communicable diseases, shortage is NCD, is also known as chronic diseases and tend to be of long duration and are the results of a combination of genetic, physiological, environmental, and behavioral factors. The main types of NCD are cardiovascular diseases such as heart attack and stroke, cancers, chronic respiratory diseases such as chronic obstructive pulmonary disease and asthma and diabetes. And as you know, NCDs are the priority as they represent European foremost health challenge. Everybody knows a person who has one of these diseases which I mentioned. People of all age groups, all regions, countries are affected by NCDs. And these conditions are often associated with older age group, but NCD deaths occur before the age of 70 years. I will not explain more about the risk factors because they are modifiable behavioral risk factors, they are metabolic risk factors, environmental risk factors, socioeconomic impact, because our speaker will provide you with all sorts of this information. An important way to control NCD is to focus on reducing the risk factors, and I am sure today you will find the answer. Before we go to presentation, I will tell you that today our webinar is possible through to multi-language broadcast to have an interpretation in 50 languages. The first one, you need click on the link Wordly. It is given in the chat, yes. Then you select the language, the next step. Then you enter your name here. And 4, click Attend. When you click Attend, simultaneous transcription in text will start in your language. And of course, you click on Unmute to listen in selected language. So this is the short instruction. I will tell you who I am. I am a treasurer and founding director at World Patient Alliance. And because I am from Poland, so I represent Euro region, and we also start information and about our region, what we need, what we can change. And with few people who also registered on this webinar, we try to establish a region steering committee at World Patient Alliance, and I hope next year we will have a meeting in Europe, and all European patient advocates are invited to participate or in person or virtual next year in our meeting. I will not tell more about myself, about speakers, because I think you can read it, and our minutes are so precious that I will use it for presentations. Very briefly, I will tell you about my organization. So this is World Patient Alliance. It is a non-profit umbrella organization, and we have now more than 500 member organization. Congratulations to our team. They really made hard work, and we have 501 member organization. We have in Europe 138, in Americas, which is also like WHO has this called this region PAHO. So it is South and North America. We have 119 organizations. In Africa, we have 125, and we have a wonderful steering committee in Africa. It is run by Regina Namata Kamoga, our board member, board director in Africa. We have in Asia 104, and in Oceania 15. What else you need to know about my organization? I think our chair will speak further about our conference. We will have this year the conference in South Africa, in Cape Town, 19-20 October. Please take it in mind, because all the region are welcome, and I am sure it will be a very successful in-person event, but also online. Today we have 3 presentations. It is first one, Essentials of Lifestyle Medicine and NCD Prevention. It will be done by Professor Wojciech Drygas. The second is role of healthcare provider and patient communication in NCD prevention. Joe Carlos is family doctor, and his organization is WONCA, Special Interest Group on NCD. The third speaker is Arno Wouters, Empowering Change, the involvement on patient organization in diabetes prevention and control. Arno represents Diabetes Liga. He is a general manager. Thank you very much all to my speakers. Thank you very much to all participants. I am sure you will enjoy our conference today, our webinar. We will see how it's with question and answer. I hope we can manage to ask our speakers for some question. And I am sure for closing remarks, you will see our chair, Andrew Spiegel. He is the chair of World Patient Alliance. I forget to mention that everybody can join World Patient Alliance. It costs nothing, so free of charge is the membership, and we offer excellent webinars. Very often we have every second month webinar, conferences, regional meeting, and support with capacity building, with some expert advices. So now we start our session. Please, the floor is for Professor Wojciech Drygas. He is a former head of the Department of Epidemiology, Prevention and Health Promotion from National Institute of Cardiology, Warsaw, and head of the Department of Preventive and Social Medicine, Medical University Łódź, Poland. He is very engaged from early beginning in research and public health activities related to chronic disease prevention and health promotion. Please, Wojciech, start your presentation, Essential of Lifestyle Medicine and NCD Prevention. Thank you.
Thank you. Thank you very much, Jolanta. Hello to everyone. There is a great honor for me and satisfaction to be among participants of this webinar. So may I ask for the next slide? Non-communicable diseases are responsible for more than 90% of all deaths in Europe. Are also responsible for premature deaths, for low quality of life, and for great financial expenditures, both from public budget and from our private pockets. And there is not only the problem of Europe, but for many other regions and continents. We all would like to live longer and better, but there are some obstacles. Next slide, please. If you analyze risk factors for non-communicable diseases based on Polish data, you may see that there is a very high prevalence of risk factors. Hypercholesterolemia, not enough physical activity, hypertension in more than 30% of all population, obesity rate is going up and up. Also, smoking tobacco number is still not very satisfied. Also, diabetes rates are going to high numbers. Thus, this picture is not very optimistic. Next slide, please. But what is more dangerous, there is the cumulative occurrence of main risk factors. And based again on Polish studies, if we analyze 6, let's say, more important risk factors for cardiovascular diseases, for some cancers, for metabolic diseases, you may see that only about 10% of all adult population, there are people without any risk factors. For most of us, I mean adult population in many countries, we possess 1, 2, 3 risk factors, but some of our adult population, there are people with 4, 5, or 6 risk factors. And these people are of very high risk of myocardial infarction or stroke or some cancers. The similar situation, for example, is in the United States, in many other countries. Thus, the number of people with high number of risk factors is still, in many countries, is still increasing. Next slide, please. Thus, you see here 7 common health risks. Risks for several non-communicable diseases. Thus, there is not enough concerns about our own health, ignorance, health conditions, and neglecting preventive screenings, then smoking habits, poor dietary choices, inadequate physical activity. I presented these risk factors on previous slides, but also what is very important, sleep deprivation and inability to relax, leading to chronic fatigue, difficulty in managing stress effectively, and also in many countries, the problem of alcohol overconsumption. Next slide, please. And let's start with nutrition. Very short, let's say, picture of this risk factor. Next slide, please. So based on Polish data, and I suppose that there are similar problems in many countries, at least in high-income countries, there is overconsumption of reft meat and processed meat items, saturated fatty acids, salt, it means sodium chloride, pastries and confectionery, sweetened beverages, and inadequate selection of some grain products. But the next slide, please. We eat not enough, at least in Poland, vegetable and fruits, dietary fiber, fish, walnuts, vegetable oils, and in our country, in many other European countries, there are deficiencies in calcium, magnesium, potassium, as well as iron in adult population, but also in children and adolescents. And also we saw vitamin deficiencies, especially these three vitamins, vitamin D, A, folates. And what the people think in Poland about their nutrition habits? May I ask for next slides? Next slide, please. They are mostly convinced that they eat healthily or very healthily. Only 17% declare that their diet is unhealthy, and 3% cannot provide any answer. Thus, it seems that dietary habits, at least in our country, are very bad, and it resides in overweight, in obesity. The next slide, please. Physical activity. Next slide, please. Very important protective factor. May I ask for next slide? Regular physical activity tailored to age, health status, and physical fitness is highly significant protective factor in health promotion, prevention of cardiovascular diseases, certain cancers and metabolic diseases, and even positively influencing human life expectancy. Next slide, please. I frequently demonstrate this slide to my students. You see that from, let's say, our head to our feet, we can identify a lot of benefits due to physical activity. If we have 1 hour time, I could present it much longer and much more precisely, but it is really very important protective factor. And in many countries, in many regions, this physical activity level is not adequate. Next slide, please. And also our brain needs exercise, and probably for some people it is new information that when we are physically active, our brain works better, we have better knowledge, we have better possibility to learn. That is also very important for children and youth. And the next slide, please. Next slide. That is about prevention in Poland, but also in many countries. It's very sad that some doctors, let's say, but also many adult people are reluctant about prevention. So there is a press information that the doctors have fear about prevention. Then they don't use the possibility to use financial funds for prevention. Next slide, please. In Poland, we have several preventive programs. For example, after the finishing of the COVID, the Ministry of Health prepared special program, Prevention 40 Plus. There was a substantial amount of money for use, but the people were not very eager to participate in this program. The next slide, please. And there is information that only maybe 400,000 of individuals have been screened, but the financial possibilities were for more than 10 millions of preventive examinations. There is really a problem. The people don't use in many countries the possibilities to check their own health. The next, please. So there is a lot of possibilities to mindful living, and how to start. What is the right way to mindful living, to NCD prevention? Next slide, please. So first, lifestyle change. There is a problem of relatively longer time. We cannot achieve all positive results in one day or even in 1 month. We should start, and in sometimes small steps, we should try to change our life habits into better choices. The next, please. Probably there is most important slide from practical point of view. It demonstrates once again what should we do to live longer and better. Thus, normalizing body weight, proper diet, limit alcohol consumption, long enough restorative sleep, coping from stress, quitting smoking, increase physical activity. Certainly, it is not easy. It is not easy, but we should do our best to take support from friends, from family, from our doctors, to use all helpful tools like mobile apps, devices like smartwatches. Let's say there is always a good time for change. The next, please. And there are plenty of very good scientific papers, hundred or thousand, demonstrating that NCD prevention is important, possible. But I think that some examples are very good. So please see here a smiling gentleman and try to guess how old is he. The next slide, please. There is Stanisław Kowalski, inhabitant of Poland, and he was never a competitive sportsman. He was very active in his normal life. He was physically working for a long time, and he started doing some sports being 80 or 90. And being 105 years, he was the champion of athletics among masters. Then he was still participating in some sports events, being 110 years old, and he died as the longest living individual in Poland, being 114 years old. Thus, I think there is a very good example that in every age we could start and we could achieve very good results. The next, please. But I think that what is the very good connection, there is a connection of intellectual activity and physical activity. And there are some examples of famous doctors from last 30 or 40 years, with Paul Dudley White being the doctor of American presidents and very active individuals many years ago. Jeremy Morris, the author of classical research about physical activity of bus drivers and civil servants. Ralph Paffenberger being the main researcher of American studies directing to physical activity, and my personal friend, Professor Fernando de Padua from Lisbon, from Portugal. And all these gentlemen were very successful as doctors, as researchers. They are promoting physical activity, and they were really very long living, as you see at this slide. The next, please. So let me finish with the very important words of Jeffrey Rose, one of the leader of preventive medicine. Better is to be healthy than sick or dead. This is the beginning and the end of true arguments in the discussion about significance of preventive medicine. I think that we all agree with his words. And may I have next slide? So we can achieve successes in every age. It is certainly the best way to start in child age. And once again, it is possible to change our life habits. It is possible to be more healthy. It is possible to live longer. Thank you very much for your attention.
Thank you very much, Professor Wojciech. It was very, very nice presentation. I know from the information from chat, people like it very much. And as you said, very optimistic. We can change our habits. Yes, excellent presentation. We can change our habits in every age. Question to Professor. There are some questions, but I think we can do it after all three presentations. The next speaker would be João Carlos. He is a family doctor. He represents WONCA, Special Interest Group on NCD. Dr. João will tell about the role of healthcare provider and patient communication in NCD prevention. Very important topic, very difficulties sometimes for patients and doctors to understand how important are these NCD diseases, because people, I talk about our patient, they sometimes think, oh yes, if I don't take a medicine 1-2 days, nothing happened, I didn't die. So they are not consequently taking a medicine. So they don't know the issue of the disease. I will tell you, João Sequeira Carlos is a family doctor in Portugal. He is also very involved in education, research with special interest in preventive medicine, social determinants of health, doctor-patient relationship, and multimorbidity and healthcare policy and managing. João strongly believes on the power of family doctors to improve health system and to inspire transforming policies, acting as community leaders and patient partners. Dr. João, the floor is yours. Please go with presentation.
Thank you so much, Jolanta. Hello, everyone. It's an honor to participate on this webinar. As a family doctor, I work every day with patients. Thank you for World Alliance, Patients Alliance, for this invitation to WONCA, World Organization of Family Doctors, and thank you, WONCA, for trusting me to make this presentation. My greetings to my distinguished session colleagues. I hope I can reach the level of your solid and worldwide recognized work on NCDs prevention. Next slide, please. I am here with you to share some thoughts about the proposed theme on behalf of WONCA, World Organization of Family Doctors. So let me begin with a short context of our organization and how we are working NCD issues. That's the institutional role of the healthcare provider aggregated in scientific organizations. Next slide, please. WONCA is an acronym for World Organization of National Colleges, Academies, and Academic Associations of General Practitioners, Family Physicians, but the short name is easier, World Organization of Family Doctors. Next slide. The organization was founded in 1972 and now has 133 member organizations in 111 different countries and territories. Next slide, please. WONCA works functionally with numerous working parties and special interest groups. One of these special interest groups, as you can see, is non-communicable diseases, or as Jolanta already told us before, chronic diseases. Next slide, please. Our work, and I am the co-chair of that group, and our work addresses several issues, mainly on the field of clinical activities and healthcare services organization, education and research projects, and health policy and management issues. Next slide, please. And group as a coordinator, Ana Cebrián, she's a family doctor from Spain, Albacete. She's an academic and works together with me, sharing the working group, the special interest group, together with Professor Manuel Sanchez Mola, also from Spain. Next slide, please. Last year, in October, there was an important landmark, WONCA World Council meeting before WONCA World Conference of Family Doctors in Sydney, Australia. WONCA launched the statement for close collaboration with WHO on NCDs. Next slide, please. The document gives a summarized context expressing the commitment of primary health care teams to provide comprehensive care on NCD's approach. I will not read every detail of these slides. Can you please pass for the next one? But of course, thank you. But of course, let me underline that primary health care teams provide the necessary technical expertise through community-based, patient-centered, multi-professional, coordinated and continuous preventative care. Next slide, please. But concerning our roles as family doctors, and we are part of the primary health care team, first of all, in a proactivity dimension, prevention and promotion by, and we have some issues that we can describe, but I will choose, for instance, the first one, developing strong partnerships with citizens and patients to empower self-care and health literacy needed for successful health promotion and disease prevention. That's the point considerably related to our webinar today. Next slide, please. More reactivity role, doing some patient management, and that's not the main issue today, but let's remind that primary health care teams has an important role as a coordinator, manager, case manager of NCD patients. Next slide, please. And also, of course, and I will choose here the second point because I will come back to that later on, balancing overuse of tests and treatments to make shared medical decisions with patients. And that is concerning already the disease, not the step before disease where we can talk about primary prevention. Next slide, please. Not only WONCA works NCDs, of course, and we work mainly because at global level, WHO prioritized that field of work many years ago. So I will remind you an important World Health Report that was from 2008 when we were celebrating the 50th anniversary of Alma-Ata, the declaration. Sorry, the 30th anniversary of Alma-Ata declaration, and the name says everything. Primary health care now more than ever, because we know that primary care teams and networks are essential for NCD management, and now more than ever, placing persons first. Next slide, please. Most chronic diseases, death, are caused by cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, as you know, and the leading causes on the main NCDs are linked the common behavioral risk factors, principally tobacco use, alcohol consumption, unhealthy diet, lack of physical activity, as we already heard from our previous speaker. These are connected with high blood pressure, high blood glucose, high blood cholesterol, overweight, and obesity. In primary care, we deal with that every day, and we are aware of the impact of several other determinants on NCDs, like these two pictures can easily show. Knowing, and the picture of the right side tell us that, knowing that only about 10% of premature mortality is related to healthcare issues. Next slide, please. Health professionals at primary care settings should take the pulse of the community while caring for patients. For me, as a family doctor, it's so much important as measuring blood pressure or doing cardiorespiratory auscultation. Believe me. Next slide, please. Mainly in the context of this well-known epidemiological transition, where we have, and during the last years, we have a transition for a considerably burden of chronic conditions. Next slide, please. So primary care should act, as you are seeing easily in this picture, as a hub of care coordination, networking within the community. And everyone is involved, every facility, every element of our health system is involved, but considering that primary care team is the core of that system, coordinating everything as a hub. Next slide, please. But to be functional, it must be firstly realistic. Health systems and primary health care have to be effectively people-centered. And assuring it is focusing on health needs, enduring personal relationship, have a comprehensive, continuous, and person-centered care, and we are responsible for health of individuals, families, and communities along the life cycle, every time, everywhere. And people are partners in managing their own health and that of their community. Next slide, please. And literature has solid evidence about the positive impact of patient-centered healthcare systems, also on integration of preventive care. Next slide, please. And prevention should follow our patients everywhere and every time. As you can see, even if the patient is admitted in a hospital, there's a chance for prevention and to promote well-being. Next slide, please. And every time, everywhere, covering different levels of intervention. I will not go in details, but I would like to show briefly that we have 4 levels of prevention. The primary prevention, that classically is associated of the state of not having a disease. So you are promoting healthy lifestyles, primary preventive medicine. Secondary prevention is on when we have the first early signs of the disease. There's a chance to prevent the onset of serious disease on that stage. The tertiary prevention is classically considered to prevent complications of diseases, in this case, chronic diseases. And one of the most important achievements in the last few years was to consider another one, the quaternary prevention. And I had promised that I would come back to that issue. And resuming, it is the level of prevention where we achieve to reduce the risk of exposure to healthcare services, because sometimes, as you know, there is a iatrogenic phenomena associated with over-medicalization that can cause harm and not a benefit. Next slide, please. The aim is to achieve a long life positive result with a healthy aging process. That's all, of course, you know that we can have an orange line that we want to avoid when we are talking about to prevent risk factors to NCDs, because we know that that's possible to have the green line with the healthcare multi-professional teams involvement, mainly on primary prevention. Next slide, please. But one of the major challenges is how to shift the financial investment paradigm in health systems. Prevention, as you know, is still underfinanced in healthcare systems. And for instance, this is the scenario of Europe, with an average of investment of nearly 3% of the total healthcare expenditure. So it's not what we would like to see, but maybe that's an important subject to our debate. Next slide, please. Because of that, the role of primary care professionals and their organizations is so important. It's so important to lobby for a global aligned action. Hopefully, WONCA and other organizations had a good relationship with the United Nations and WHO, and we are now aligned as an organization, WONCA, aligned with also with the UN, working together on the 17 Sustainable Development Goals, SDGs. Next slide, please. And as you know, one of the 17 SDGs is directly related to good health and well-being. That's the third one. And the SDG 3 has a target concerning NCDs. That's target 3.4, with objectives to be achieved until 2030. Let me underline the linkage between mental health. Well, we can see mental health and well-being, since prevention of NCDs must combine actions to classical modifiable behaviors, such as tobacco use, physical inactivity, unhealthy diet, or alcohol, but also actions to promote a safe, multidimensional psychological environment to achieve communities with better levels of mental health. Next slide. WHO in Europe also defined some targets, the already well-known 9 targets on NCD prevention, and that will be to reach until 2025. That's a very demanding issue, and I will not read everything. You know it well with numbers, but of course the core we know it's to reduce about 25% in the risk of premature mortality from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases. Next slide, and I'm almost finishing. It would not be possible to close my presentation in a World Patients Alliance event without talking about the need of a strong connection between healthcare providers and patients. More than ever, and also in NCDs, we need a co-production of health with shared responsibilities from every element of health systems. Let me underline this particular cell. I have not a pointer, but the cell under the co-production, the right side, that tell us that particular thinking. Care is shared between patients and professionals, and that must be not the core of this framework, but for me, every day working at patients is my philosophy of my clinical practice, working together with patients. Next slide, please. Almost finishing with some farewell slides. Don't forget to join your family doctors to celebrate their World Day. It will be on May 19. There will be a lot of actions all over the world organized by WONCA. The theme this year is Healthy Planet, Healthy People. Next slide. And also from WONCA, Please consider to come to Lisbon next year, 2025, to attend Wonka World Conference. There will be several sessions and workshops to debate NCDs, and we have the target of 2025. So let's hope that we have something important to present there. Next slide. And finally, I will quote World Patients Alliance. That's beautiful. Together, let's embark on a journey towards mindful living, where every choice we make contributes to a healthier and more vibrant future for all. Thank you.
Thank you very much, Doctor. It was very, very informative, very productive presentation. Now we will very in hurry a little bit come to the last presentation from Arnold Wouters, General Manager from Diabetes Liga. Arnold will tell us how to empowering change, the involvement of patient organization in diabetes prevention and control. Please, the floor is your, Arnold.
Thank you very much, Jolanta. Thank you also for the opportunity to speak to this worldwide forum. So as mentioned before, I'm talking on behalf of the Diabetes League in Flanders. So Belgium is a split country, as we have to say. There's a Flemish part and a French-speaking part, and we are only active in the Flemish-speaking part or the Dutch-speaking part, because Flemish is just another dialect of Dutch. So the Diabetes League is a non-profit patient organization, and we are committed to fight against diabetes. And in awaiting that to happen, we encourage people with diabetes to enjoy their life with as few constraints as possible. As an independent association, our league strives for the best medical and non-medical care and support for everyone who is confronted with diabetes. Next slide, please. So on that perspective, we tend to have a slightly different view on the chronic disease that's called diabetes. And often we are confronted as a patient organization that in too many times people are looked upon only as a patient and only from a medical perspective, meaning, and all that is great, meaning that it is often the healthcare professionals that are looking at what's happening to somebody with diabetes. And one dimension that is often forgotten is that also the patient has its own needs, and there's also patient perspective. So in what we are promoting is that if you want to act upon prevention, then you need to take into account both perspectives, not only the medical perspective, but also the perspective of the patient. And that the decision that is made on behalf of the patient is a mutual decision. It's a shared decision, and it's not only the professional who decides, like God sitting upon his mountain, to decide you have to do this, and you have nothing to say in the conversation. So next slide, please. So having said that, the Diabetes League has 2 prevention programs active for several years already. And it's clear that in Belgium, 1 in 10 Belgians is confronted with diabetes, and in more than 90% of the cases, it's diabetes type 2. Diabetes type 2 is a disease that can be prevented in more than half of the cases by healthy lifestyle, as been said by the 2 previous speakers on the other chronic diseases. So it's not different for diabetes. It's also important that the condition of diabetes is detected as early as possible, as mentioned by my 2 previous colleagues. So we say it's time for action, and we call the Belgians for action with 2 prevention programs that I will describe briefly. It's Halt to Diabetes, the name speaks for itself, and then Zoetzwanger, which you could literally translate as being sweet pregnant. So I'll explain it later on. So next slide, please. So the main message that we have for people with diabetes type 2 in an early stage is that it's able to fight against the disease, and that in more than 50% of the cases, it's even possible to defer the situation. And we invite people to use one of the calculation engines that we have developed based upon the FIT-RISK methodology. So it's a calculation developed in Finland that we have adapted to the Belgian situation, and that has been accepted by the Flemish government as a calculation method that is able to detect an early risk. And it's essential, as has been described, that a healthy lifestyle is taken up as soon as possible. And it's always the same. There is no surprise here. So we have to fight the body weight. So we're aiming for healthy body weight, of course. And we often see there is more and more a parallel with the steep incline of obesity as a chronic disease. So diabetes is following immediately obesity. We are promoting healthy and balanced diet and dietary needs. As previous speakers said, exercise is crucial, and regular exercise is crucial. And then, of course, the tobacco stop. Tobacco stop is also very crucial in our program. So next slide, please. So what you see here is our FIT-RISK or our adapted FIT-RISK method. And then based upon a few questions, it's like a dozen of questions. People have to fill in like their body mass index, their height, is there any diabetes known in the family, how often do they exercise, do they smoke, do they drink alcohol, and so on and so on and so on. And based upon those answers, it calculates a risk. If you're green, it's no issue. If you're orange, then you have to pay attention. But if you're into red zone, that means that you have a risk more than 12 in this case. It's definitely clear that you need to take the results of this calculation to your clinical advisor. So it could be the doctor, it could be another healthcare professional that could guide you in that in that matter. So that has to be. I hope this is very clear. As a patient organization, we are not able to take a medical point of view. We have to take into account that it is a doctor who needs to take action. But we are only making people aware about the risk. This is the only thing we can do as a patient organization. And upon that method, our advice is, if you're in the red zone, go to your doctor, talk about it, of course. Next slide, please. So if you look upon where we are dispersed in Flanders, we are already active in 26 of the 60 regions. So, and 4 are initiating the program. So in a few months, half of the 60 regions will have started the Halt to Diabetes program, and it is still growing. And this is well thought of strategy. It's not a top-down approach, it's really a bottom-up. So we are approaching small local entities, clusters of several communes, or a city with some communes, and then we act upon those actors, and then we try to convince them to start a program. And it's with dietitians, it's with physical trainers, it's with psychologists about tobacco stop, and so on and so on and so on. So it's a very well thought of methodology. Next slide, please. Can move on to the next slide. Am I lost?
I can hear you.
No. You have to move up one, please. Yeah. No, still one up, please. No. Yes, that's it. So as you can see here, so we've started the program in 2019, and last year we covered 23 regions. So this year it will be 30 regions, and we have given 70 educational trainees to now thousands of people. But we also organize webinars and educational training for the health professionals. So as you can see, multiple professionals are trained also by us, because it doesn't mean if you're a physical trainer or you're a doctor or a dietitian that you're specialized in diabetes. So we also instruct those professionals. So what do you have to pay attention for? So what is best practice, and so on and so on. And there are also specific formations for dietitians that are well thought of and well followed. Next slide, please. So this was the Health to Diabetes program. So, and this is Zoetzwanger, and Zoetzwanger is a gestational pregnancy diabetes program. So every year more than 4,000 women, pregnant women, develop gestational pregnancy diabetes, but they're often not aware. And we have a program where we can follow them up for more than 10 years, but it's a free registration program. So they're not obliged. So pregnant women who have developed diabetes are not obliged to subscribe to the program, but it is a free subscription program. But those who do subscribe get every year an invitation from the Diabetes League saying it's the one time of the year where you have to check your blood. So go to your doctor, please, have it checked, check if you're not developing diabetes after your pregnancy, because it has been is well proven that women that have gestational pregnancy diabetes have a much higher risk to develop diabetes later on when they get older. And also, the sooner you detect this issue, the better we can work on the children and on the babies. Because if a pregnant woman developed diabetes while being pregnant, the risk of the child to develop later on diabetes is also much higher. So this is what we do. Since April last year, we also developed a multi-language tool. So until then, it was only in Dutch. But as from April 23, the program has integrated several other languages like Turkish, Arabian. Now we're going to use Ukrainian, Polish. There is also a version of Hindi that we will use in our program in order to reach out to another type of population. So people with a migration background, often those women, they are not native Dutch speaking, that's for sure. And they fall into like a black hole, and they are often forgotten. So since that we started the program, more than 500 women enlisted, non-Dutch speaking women enlisted to the program and receive in their language a written invitation and more background information about what the program does and why it's a good thing of them to follow the program. Most of the time it is an online registration, but we keep postal registrations open. So we are not moving entirely to a completely digital program, because we also want to reach out to that population with a low digital knowledge or low digital experience. So we will always keep postal and written registrations on to women to follow the program. So they not only have to enlist by an online way. So next slide, it's almost my last slide. There's also an aspect that we often forget, although the previous speaker did mention it. There's also like an economical benefit on the prevention, and there's a huge impact on the healthcare budget. Often, I can only talk about the Belgian situation. If you look to the Belgian situation, more than 24 billion euros is spent on a Belgian level for a medical treatment. But next to that, there is also 8 billion euros spent for sick leave at work. And above that, there is a loss of more than 1.5 billion euros on a less economical participation. So if you add that up, the cost of not well following or chronic diseases is huge. And there is, depending of the source, for the Belgian health system, some of our partners have calculated that €1 invested in prevention saves up to, depending the source again, 5 till 8 euros in healthcare and societal costs. So this is also an aspect that we as a patient organization try to stress towards the government, the several governments of Belgium, saying it really pays off if you invest in prevention, because within 5 to 8 years of time, you will save 5 to 8 times the money you've invested in prevention. And with an aging population and with longer medical costs and economical costs for society, this is probably a wise thing to keep in mind. So I'm just in time. So this was my presentation.
Thank you very much, Arnold. I saw the chat, so every participants are very happy with all presentation, and thank you for the practical advices and for practical issues. So thank you to all participants also. I am sorry we don't have time for question and answer, but all presentation will be uploaded, so you will have all information. If somebody has any specific question, please send it to the office. I will try to contact our speaker to answer you if you don't find the presentation the right answer. Thank you very much. A good afternoon, good night, good evening, and we will hear you soon. Oh, Andrew Spiegel, are you online, Andrew? Our chair, I promise you, he will join us, but I don't know if he is.
Yes, I'm here.
Yes.
I'm here, Yolanta. I just wanted to thank you for running this webinar and organizing it, and thank all the great speakers and all the participants for coming. I also wanted to remind everybody about our upcoming global conference, which is going to take place in South Africa. You can see it on the screen now, Cape Town, South Africa, October 19th and 20th this year. So please go to worldpatientsalliance.org to register. There will be a virtual component, but certainly if you can, you want to come to Cape Town for the 2-day in-person event. So again, I know we're over. I just want to thank everybody for coming, and we'll see you at the next webinar. Take care.
Thank you to all of you, and goodbye. Bye.
Thank you.